Hey guys, it's Caitlin. If you're new here, I'm a uterine cancer survivor. I want to talk about everything that went wrong after my hysterectomy. If you want more videos of me just talking about what I went through, answering questions, make sure to leave a comment. Please like and subscribe, and let's get into this video. If you're new here, here's a little recap of everything that happened. I was very sick as a teenager. I always had very horrible periods. I was on and off birth control like every other year, and I had cysts on my ovaries, and then things took a turn for the worst, and I ended up having a massive tumor in my uterus. It took years for them to figure out what it was. Then I had a hysterectomy in 2021. If you haven't watched my full cancer video, I recommend going and watching that. And I think I've posted a few other ones explaining a little bit more of what happened, what I was doing in between waiting for surgeries or test results. I went to a natural path. That video is up now, and just the bad experience I had with that. I'm now cancer-free. I did not have to have any radiation or chemotherapy. They just removed the cancer and expect it not to come back. It's kind of crazy what happened after I had the hysterectomy. Things did not go as planned. I laugh about it a lot because tests that I have or surgeries, things go wrong, or the cancer that was like very, very rare. Everything is so rare. Every new doctor I talk to, they're like, that's so rare. And then having this infection after the surgery, that was also very rare. If the doctor tells me that it's very rare for this to happen, I'm like, oh dear, here we go. Like, I'm just waiting for it to happen, honestly. January 13th of 2021, got up at 5 a.m., had to be in London Hospital, which is an hour, maybe a little bit more away from where I live. I don't know if I was getting up at 5 a.m. We must have had to have been there 7 or 8 in the morning. My parents drove me to the hospital and they weren't allowed to come in. They had to drop me off at the door. My mom gave me a hug. I probably hugged my dad too. I don't remember. And I took my backpack and as an 18-year-old girl, walked into the hospital to get a full hysterectomy because I had cancer. I remember it was really cold that day. I live in Canada. It's January. Just remember it was cold. It's probably snowing or something. I was very nervous, obviously. I had been going to this hospital already for probably 6 months. I was very comfortable seeing a nurse and just simply asking, hey, where do I go? I'm this person. I'm supposed to see this doctor, and, you know, them telling me where to go. I got to my pre-op and the nurses were so nice, just checking in on me and making sure I was okay. They give you like, I think it's like a little bit of sedative medication. I was very nervous, just having a lot of anxiety, so I had been given that kind of medication. I don't really remember much. I remember getting wheeled into the operation room, being put to sleep. Honestly, I know people are like, some people really don't like anesthesia, but whatever, the medicine that makes you go to sleep, but I love it. It's so relaxing to me. You're just falling asleep. It's the most relaxing sleep you're ever gonna go into. So I don't know. I'm fine with it. I definitely was on a ton of pain medication after I woke up. I don't remember, probably 12 hours or so after I woke up. I don't remember anything. They had to call my mom and she was talking to me on the phone because I was freaking out that I was going to have pain. That's something that is reoccurrence to me. Every time I have a surgery, I wake up and I freak out like that, and they end up giving me a ton of pain medication. And I don't know if I'm actually in pain or it's just an anxiety thing. If I can feel anything, I am freaking out. I think I was in the hospital for 4 days, 3 nights kind of thing. The doctors wheeled me out on a wheelchair. I got in the van and took me home to start recovering from this major surgery. My incision I would say it's like a 4-inch incision from my belly button down. I had staples. I was very scared to look. I was scared of what I was going to see, but once I did, it wasn't as bad. Definitely a lot of bruising. I'll put a picture of what it looked like somewhere. If you don't want to see that, then just look away for a second. Yeah, that was what it looked like. They gave me a paper and I was supposed to have my staples removed. I believe it was like 9 days after the surgery. So I had my post-op appointment. My doctor said everything looked good, but I definitely was not getting any better. Like, I was just staying the same. I was having a ton of pain in my stomach. I couldn't stand. And I know, like, I think it's the same for C-sections too. Like, you can't really stand up straight, but this was like, I was not getting any better. Like, I was walking hunched over. I didn't do much walking. Like, I would walk from the couch to the washroom. If I had to shower, I showered sitting on a chair. I was still taking a lot of pain medications because things were so painful. The post-op appointment, he said everything looked fine. The incision looked good. Pain was normal. Guys, if you've watched my cancer video, please go watch it if you haven't. I have felt a lot of pain. The tumor that I had before I had the hysterectomy was making me go into labor. So I was in labor 2 or 3 times a week for like a year before I had this hysterectomy. So I know pain. And when I'm saying it's really painful,
he's saying, oh, it's normal.
I should have spoke up. I should have said, wait a second. No, it's not. This ain't normal. But I didn't. Probably because I was alone and didn't want to speak up and argue with the surgeon that is supposed to know best. Guys, once I had the staples removed, this is going to be nasty, but my incision opened. This is going to be graphic. You could see stitches inside the incision. It was that open. I believe I had called the oncologist at night. I had told them that I was just in a lot of pain and the incision had opened a little bit. I got another appointment with my surgeon. I think that this time my mom might have been allowed to come with me, or I just got in a wheelchair and a nurse wheeled me up to the room. Maybe that's what happened. Once I was in there, I, laid down on the bed there in the doctor's office, and he took a look at the incision and said that, well, it was too healed to staple it back together. So I was just going to wait for it to heal. And if there was an infection, that it was better if the incision was open, then the infection wasn't stuck inside. I'm sorry. Just retelling this, I'm actually flabbergasted. There was the most massive infection brewing inside me at the time of this appointment. So I went back home. The surgeon that knows everything just told me that looks fine. I had to keep on changing my bandages. It was really nasty. Honestly, my wonderful mother, if you're watching this, love ya. She changed those bandages all the time, made sure that it was clean and everything. I had the hysterectomy January 13th, and by February 10th, I did not get any better. I was getting more and more sick by the day, and then I had a really high fever. I called the oncologist and she said, oh, okay, like a fever is a red flag, so you gotta come in and we'll check you out. I think that my mom had just wheeled me in with a wheelchair and then a nurse took me from there because I could not stand. It was very, very painful to stand. If you're a cancer patient, they treat you differently. Usually you get brought back right away to your own room. Then you wait there for a doctor to come. I was waiting in this room for like 20 hours or something. And there was a guy that was seriously crazy in the room beside me. And for 20 hours straight, he said,
wait, what? Wait, what?
20 hours. I don't know what kind of drugs he was on, or maybe he had like mega OCD and was on drugs, but that was crazy. Once the nurse came in, it was a young man and he was in training. Like, please just give me a nurse that knows how to put an IV in. He poked me so many times. My whole arm was bruised, and then he had to do the other arm because he couldn't find the vein. Finally, you know, they got the little old lady from upstairs to come down, and she like got it the first time. I had an ultrasound, I had a CT, and that is when they saw massive blood clot in my stomach. Not my stomach, my abdomen. I don't know, just floating around in there. Then I finally got my own room, and this is where I would be staying for the next 5 days, just trying to heal and recover. Honestly, these 5 days are probably the worst time that I've had in a hospital, being alone. Even my hysterectomy, I was probably just in shock of what happened. The nurses were amazing. I was excited to just get back to normal and heal. But this time being in the hospital, it was horrible. A team of nurses came in, and at this point, I had a catheter put in. I was not even able to stand to go to the bathroom. They like transfer you from your bed to a gurney, a hospital bed that has wheels, I guess. So they transferred me to there. I went to a surgery room, I guess, where they were going to put a tube into my stomach. This is a very traumatizing event for me. I just remember being so scared. The nurses were so amazing. They were holding my hands. They give you some like light sedation, like you're fully aware of what's going on, and then they like numb around where they're gonna put the tube in. The thing that freaked me out, and this is why like I give credit to women who have C-sections, I don't want to feel pressure. I could feel the pressure of them putting this tube into my stomach. That freaked me out. They actually gave me like a face mask so I couldn't see anything because I was like, I don't want to see. Once I went back to the room, I had to have 2 blood transfusions because I was so anemic. I was so pale. I definitely looked horrible. My surgeon came to visit me after the tube was put in and I was having a blood transfusion. He came to say hi and see how I was doing, and he looked at me and said,
Yeah, we can't send you home when you look like this.
I'm glad that it took almost death for you to listen to me after my surgery. No, I don't want to say like he was a bad surgeon. He was amazing. I think just that when I was saying that I had pain after the surgery, he definitely didn't understand that the pain I was having wasn't just normal post-op pain. Once I was finally allowed to go home, that's when I finally started healing. And again, I'm so thankful for my mom because she drained that disgusting bag. I had this tube with a bag that was draining this nastiness, and my mom would change that bag and she kept everything clean. I could not have done it without my mother. Honestly, I think I started feeling better pretty quickly. I went out for breakfast with my friends the one day, and like I had this tube for I think 5 weeks. I had the bag and everything. You know, I went to gatherings, I hung out with friends, I had went to a party with this bag on me, and my mom actually she had sewn a case to go over it, and it was blue with polka dots. There wasn't just this nasty thing hanging off of me, that it was covered a little bit. I think it was the end of March when I finally had that removed. I had a few appointments in between there. They would do an ultrasound and see that there was still fluid, so then I would have to keep it 2 weeks longer and 2 weeks longer. Having that removed was very scary for me too. I had just freaked out so much having it put in, and the doctor who put the tube in, he remembered me and he was like, oh, I remember you. Yeah, you were having a really hard time last time. And I'm like, yeah, I was very scared and I'm very scared today. He said that it was going to be very quick and it wasn't going to be painful, and actually it wasn't. What's crazy is that I ended up cutting asparagus like 2 months after I had the tube removed. That was very good for me. I think my parents noticed that I was definitely falling into maybe a bit of a depression. I just wasn't very good mentally, and I just wanted to stay on the couch and not do anything because I was used to that. For so many years already, that was all I could do. So it was very nerve-wracking to start doing normal chores around the house. My parents have a farm, and the last 2 weeks, so in June, I went and cut asparagus, and then I got a job at a summer camp. And that's when I noticed something wasn't right. Things were hurting. It felt like there was something being pulled. It was just very uncomfortable. Without going into too much detail, which I feel like I do already, like I overshare, where they removed my cervix, it was painful. Something was going on that did not feel right. So I went in to have it checked, and he did, I think it's a pap smear. Women have this done all the time. It's like a little stapler. They put it up there and they like take a little chunk and send it off to make sure everything's good. So that's what they did, because there was this little, well, he didn't know what it was. There was definitely something there. Guys, when the test came back, like I said, if something's gonna go wrong, it's gonna be me. The test came back and it was a piece of my fallopian tube. They had sewn my fallopian tube where they removed my cervix. They just accidentally sewed it in there. I had to go in and have like a day surgery. They removed the fallopian tube. Once that was done, then honestly, things seemed to be normal. I still had a ton of pain every month when I would ovulate because I still had my ovaries. I just figured that was normal. And I would tell my doctors about that. And at this time, I was having a CT, MRI, and like ultrasounds every few months, just, you know, make sure everything's still good, make sure there's no cancer like popping up anywhere else. What they noticed was there was a really big cyst on my ovary, and they were just kind of keeping an eye on it. In 2022, that year, like I didn't have any procedures. I definitely had a lot of tests still, but you know, I got baptized, I got married. During that time, my surgeon actually retired. So I was like in between surgeons. I seen this one lady for a little bit, and then I seen this man, and finally like I got stuck with one surgeon, and he was really good. I ended up having like a meeting with him. I went in this room and like there was like a long table, and I sat down and he was like, "Oh, there's no one else with you?" And I'm like, "Yeah, I'm not used to bringing people with me to appointments because it's been so many years of me not being allowed to." So during this appointment, he said that it really didn't look good. My left ovary, it looked like there was really big cysts all over it. Yeah, that was probably what was causing a lot of pain. In October of 2023, I had my left ovary removed. At my post-op, he said that how he explained it was that my ovary looked like black sludge. Endometriosis had literally eaten away like my whole ovary. It was just endometriosis. Today, I have not had any pain really since then. I do get cysts on my one ovary, and sometimes I do have problems with that. And of course, like having a medical history like I do, I'm always very nervous when I do have pain. I always get it checked out, but yeah, the cysts are kind of, they go away and then they come back. I want to keep my right ovary. I want to keep it and not go into menopause. I'm now 24, and yeah, I just don't want to go into menopause, honestly. Like, I would rather just keep my ovary and deal with sometimes having pain. And if I do have pain, it's like every other month, because I only ovulate every other month because I only have one ovary. So when I had my left ovary removed, they did the incision right on top of the incision where I had my hysterectomy. And that was, oh man, that was traumatizing. It just felt like I was doing everything all over again. Luckily, the recovery for this surgery was quick. Made me realize that that was how my other surgery should have went. Like I should have recovered pretty fast within a few weeks, you know, walking down the laneway and getting back to normal life. You know, things happen, I guess. That's kind of it, just everything that happened after my surgery, and I guess things just don't go as planned sometimes. If you made it to the end of this video, thank you so much for watching. Please like and subscribe, and make sure to hit that bell button so that you're notified every time I post. Again, thank you so much for tuning in to my videos, and I will see you next time.